everyone, welcome to my presentation and my YouTube video. So my computer is on its last leg and it's not going to be able to screen record, and I don't have anybody here who can help me videotape, so I'm just going to have to do it from my iPhone. So I picked a bacterial disease for my project. I chose Necrotizing Fasciitis, which many of you have probably heard of. I know it's popular on all the medical shows like Grey's Anatomy and ER because it's a very scary and dramatic disease. So what is necrotizing fasciitis? This is a bacterial disease and it is known as the flesh-eating bacteria. It's very fast spreading and it eats away at the soft tissue, so the skin and the muscle. It can involve more than one type of bacteria. There are many combinations of bacteria that can cause it, and up to a third of the cases involve MRSA, or the methicillin-resistant staphylococcus bacteria, which MRSA becomes prevalent in a lot of sporting facilities where there's a lot of sweat and blood and everything, and it spreads really fast, and it's very dangerous because it is resistant to many antibiotics, so it's hard to treat. Necrotizing fasciitis will often infect the limbs or the perineum. Who does it affect? So this disease affects men and women equally. It doesn't have a preference. It's prevalent in trauma patients, so any type of open wound in the skin, it can easily spread there and spread throughout that area. And it doesn't have to be an open wound. It can be something as small as a needle mark. Although it is very deadly and scary, it's very rare. There are fewer than 1,000 cases a year, and on average, 0.4 out of 100,000 people in the US will get it versus 1 in 100,000 people in other parts of the world. So those are still pretty small numbers, and it's not very common. Especially people who suffer from diabetes or substance use disorder are bigger risk factors to get this because they do use needles, which leaves open wounds where the bacteria can spread more easily. But for some unknown reason, it can come to affect a normal, generally healthy person. Uh-oh. Sorry about that. So what are the symptoms? Somebody with NF would probably start feeling a fever, swelling of the area, excessive pain. It might appear that they're getting abscesses or cysts, and bullae, which is bleeding under the skin, and they'll probably start to feel decreased nerve function because as that bacteria eats away at the flesh, it will kill the nerves, so you might not be able to feel that area once it starts spreading. How can it be treated or prevented? So typically when somebody gets this disease, fast treatment is key. You need to go to the hospital as soon as possible to start getting it treated because it spreads so fast and it will just literally eat your flesh. So the first thing they'll do is probably do surgery to remove the necrotic tissue. So the tissue's already dead, there's no way they can save it, so they might as well go in and take it out before it spreads more. Other things they would do would give you IV antibiotics, usually in a combination of antibiotics like penicillin, clindamycin, and vancomycin. In order to prevent it and prevent from it spreading would be to care for your wounds properly and use proper hygiene. So when you're using needles, make sure you clean the skin first and wash your hands regularly. Even with these types of treatment, the chances of death with necrotizing fasciitis is still between 25 and 35%. So you do not want to mess around with getting your treatment. So here you can see the early stages of what it looks like. You can see his skin is starting to look swollen around the ankle, it's getting red, and it's purple more in the middle, which is probably where the wound is, where it spread. And here is a late stage photo. So it is obviously spread from the hip area to the knee, and it has eaten away at a lot of that top layer of skin. So it spreads very fast and it just literally eats your flesh. Now these are pretty scary and gruesome pictures, so I will leave you with this little guy who represents the flesh-eating bacteria eating under your skin. And here are my works cited. But thank you for joining me. I hope you learned something here, and I hope it didn't gross you out too much. Thanks for watching.